Rahim, Dr. Alsayouf, consultant pediatric neurologist, American board. Today we're going to continue our series of epilepsy in children, and we will talk about a very important topic that every family should be aware and should be trained for this situation. Especially families with kids with epilepsy. It's a first aid for seizure. What should I do when the patient have a seizure? And mainly we are talking about the generalized tonic-clonic seizure. This is a question we always get asked by the family, and it's also something that every family with a kid with epilepsy has to know. What happens when the patient starts seizing? The first thing we tell the family, please calm down and don't panic. The patient is seizing does not mean that he is dying. I know the look of the patient during seizing, especially generalized tonic-clonic seizure, is really bad, and it is not uncommon. Whilst one of our colleagues in the ER or a pediatrician who would call you with anxious tone about a kid seizing in their clinic or in the ER. First, don't panic. Second, please take the patient away from any danger around him. If the patient starts seizing while he is swimming, you need to pull him out of the swimming pool. If he is seizing next to a boiling water or next to food being cooked, take him away from the danger. Second, put him on his left or right side, so the saliva or the excessive drooling, it will not block his airway, and he does not also, and it will not also he will not aspirate. Third, don't put anything in his mouth. Don't put anything in his mouth. Don't try to open his mouth. This muscle is called masseter, is a very strong muscle, and if the patient has a locked jaw during the seizure and you try to open his mouth, first you are wasting the time. Second, if you try to put your finger in his mouth, this muscle can cut your finger and it can go and close the airway. And third, the kids, if they are put while they are seizing to the left or right side, the airway is very and extremely unlikely to be compromised. Fourth, if this is the first attack, please take him to the ER and or call the EMS or the ambulance, but make sure if you take him to the ER to drive slowly and calmly. You don't have to drive at 200 km/h and make a disaster to get them to the hospital. Luckily here in Dubai and UAE, most of the hospitals are within 10 to 15 minutes drive of any of the majority of the houses. If he's a known case of epilepsy or seizure and he has been seizing more than 5 minutes, give him the rectal diazepam to abort the seizure, or the buccal midazolam that would go through the buccal mucosa to stop the seizure. And make sure you also inform his pediatric neurologist or whoever is taking care of his epilepsy that he had a breakthrough seizure. The reason for that, so we can adjust the medication. Remember, we start low and we go slow. Majority of the time we put the patient on the lower, maybe half of the dose, half range of the dose, and if he starts seizing, we start going up until we reach the maximum dose, or the patient does not tolerate the medication anymore, or the patient seizure get very controlled. That's are the main and basic first aid seizure for the patient with the epilepsy. I hope this information are very helpful for you, and thank you. We will see you in the next episode where we are going to talk about the epilepsy medication and overall look. Thank you and have a good day.